You're listening to the Toe Talks podcast. Today, we bring awareness to the atrocities that hospitalized patients endured during the scam-demic, the inhumane practices, egos, discrimination, and medical failures that were perpetrated on patients by the medical community itself. We will spotlight how healthcare professionals stopped critically thinking, stopped practicing evidence-based medicine, and stopped allowing for bodily autonomy. Hospital administrators told physicians how to practice medicine while holding their jobs as leverage, and exchanged the health of human beings for governmental, pharmaceutical, blood money. Stick around. You're not going to want to miss it. We are the rugged, authentic savvy, and you're in the right place. Live free, pursue health. Powerful living starts in 3, 2, 1. They stood there wringing their hands and watching him slide downward. They had no answers. They had forgotten how to treat simple organizing pneumonia. Everybody was treated the same, and the protocol was killing people.
Kidneys shut down because of COVID. I'm sorry, but COVID doesn't cause kidneys to shut down. It's the medication. I mean, it's like they've all lost any kind of education about how you're supposed to treat somebody who has pneumonia. Did you do a data dump and become dumb overnight?
3 male nurses were awesome because they were amazing men who seemed to really care about their job and care about me. All 3 professed belief in Jesus. One even came back after a shift to pray with me.
I like to call her the phlebotomist from hell. Do you remember that, Lee?
Oh yeah, clear. It was so much pain. That was an awful experience. No, the whole goal, I think, was to put me on high flow oxygen.
I fully believe that probably saved your life because I think they were grooming you for a ventilator. What you are about to hear is a very raw and very personal story about the COVID hospital ovens. We must tell our stories, and the world must never forget them, and the important takeaways that can be gleaned from the events that unfolded in the fall of 2021. Welcome to the Toe Talks podcast, episode 11, part 4, the hospital ovens and patient prisoners. I'm your host, Dr. Toe, and along with me, my husband, Lee. Today we're going to pick up where we left off. Lee was isolated and sick in a hospital an hour away from me, and his status was worsening. Today we're going to talk about how he endured incredible pain by a specific healthcare worker and how the nurses began to play this oxygen game with him. And then, miraculously, how we exited out of the twilight zone of bad medicine into good medicine. Let's dive in. So I dropped off more contraband. I gave him more NAC, gave him his own personal pulse ox. I began to question whether the pulse ox on his finger was accurate or not. The funny part is a nurse at one point didn't trust it either. She's like, I can't remember. I think we'll talk about it here in a little bit. But his pulse ox was saying it was one thing. And so she decided to take a reading from his ear and it read higher. The nurse mentioned that part of the reason why she took the ear reading was because Lee's hands were so cold. Anybody who's in healthcare knows that if you've got cold hands, the pulse ox is not going to read very accurately. I was like, it's time to give this pulse ox to Lee. So now he has his own little device, nifty device to compare when people were telling him it was dropping. And so he would also know how he was doing. Day 11, 10:23. We happened to have a fairly good physician that day because Lee was having this issue in the morning where he'd be stuffy. He has this nasal cannula in. And the physician actually said, why don't we try a face mask? It would be less drying and we'll attach a pennant to it, which acts like a reservoir to hold oxygen. so that it feeds the mask efficiently. It might be more beneficial in order to get oxygen in when he's stuffy. And my mom, I don't even remember this, my mom actually said to him, hey, take that nasal cannula out and actually put it in your mouth when you are having respiratory distress.
I remember that.
And it was a game changer for Lee. It was so helpful. But I think because we had told the physician that, he was like, well, why don't we just give you a mask instead of a nasal cannula? And maybe it'll also help you with your stuffiness in the morning.
I know some negatives about that were because you can't go that high with a mask. It only goes so high in your oxygen, level providing oxygen.
They had turned it up on that day to 10 liters. It might not have been as effective as, putting it in your nose. I agree. So that could have been partly what it was. But it's better to have, I guess our reasoning was it was better to have some oxygen going through your mouth and not just shooting in your nose.
It was a game changer.
It was not gonna get into you,
Hard to sleep as well, but...
No, there's no sleep for the sick in the hospital. Day 12, 10/24, 3 liters O2. The nurse woke you up with a oxygen saturation of 70. And she decided to take this is where she decided to take your pulse ox from your ear. And then it was in the 90s. It was 92. I don't know. It kind of makes me wonder whether the pulse ox was really accurate in the hospital. The respiratory therapist then came in and turned it up to 10 liters. This same day, Lee was visited by a very special person.
Yeah, the nurse torturer.
I like to call her the phlebotomist from hell. Yes. She told Lee that she came into the room, wanted to take his arterial blood gases to test it to see what the saturation of his oxygen was in his arterial arteries. Now, everybody has had blood drawn from their veins. Very few people have ever had blood drawn from their arteries.
And you do not want it.
If you know anything about the human body, the reason why they take it from your vein is because the veins are more peripheral. They're more on the surface. Arteries are lower down. That's a mechanism to protect us. So if we cut something, it's far better to cut a vein than it is an artery, because the arteries have muscle to them and you would just bleed out so much faster. So you have to dig in order to find this artery and get it. Well, she not only did one arm, she did 2 arms because she could not find the artery.
Yeah.
Do you remember that, Lee?
Oh, yeah. Clear.
Yeah.
It was so much pain. That was an awful experience. And I don't think she ever got it.
She didn't. There's something wrong with the machine. I think she did get blood drawn, but she couldn't get it to read.
Right.
Or if she did, it was like, oh, I think it's this. It's moderate. But then do you remember what she wanted to do after that?
No, the whole goal, I think, was to put me on high flow oxygen.
Yes.
Which would be like 15 plus.
Yes. And so she had this device. It was a concentrator of some sort that she was going to put on your oxygen device as an adjunct in order to increase the oxygen level you were receiving. She wanted to be able to turn it up from 12 to like 15, 16, 20. And Lee denied it. I fully believe that probably saved your life, because I think they were grooming you for a ventilator.
Mm-hmm.
They were trying to get you dependent on O2. It's evil.
Sad.
It's so sad to think that is what was happening, but I really feel like that was the end goal there. I think it was miraculous. I think God gave you wisdom and strength at the right time to say, no, I don't want it. And I think you might have been so mad after what she had done to you that you're like, get out of my realm. I don't think I would have blamed you.
So can I trust this lady?
Yeah.
And poked both arms, searching around for an artery, not a vein, to take blood from to check his O2 levels. What the heck? They just tortured you. Don't let them do that again. Oh my gosh. Ridiculous. For what? Yeah, just to confirm that the monitor was right. Then he wasn't given a level. Well, what was it? She just said it was low. Oh my gosh.
Day 13, 10/25. Lee continues to decline. He's been declining for the last 5 days with no change in his treatment. When they finally decide, this is 5 days of declining, to do a CT scan of his lungs. I had this conversation with a doctor. I said, well, what's the CT scan going to show you? Well, it's going to confirm that he has pulmonary emboli in his lungs, basically blood clots in his lungs. And I said, well, what would you do to treat him if he had that? I'd increase his blood thinner, his heparin. I said, well, why don't you just do that and see if he improves? If you're not going to change the way you treat him, why are we going to subject him to more radiation, which he's already had a lot of because of his CLL? And I get it. He wanted a baseline. He wanted to see how his lungs were looking in general and how they would progress forward and getting better and improving. But I just knew he had already had so much X-ray exposure. He's already fighting cancer. I didn't want to wait either. I didn't want to waste time. Let's go ahead and get this thing going. Fine if you want to do a CT scan, but let's at least get this treatment going if this is where we think the issue is lying. And all symptoms pointed in that direction. And the doctor's like, well, I won't do it without it. Fine, do it. Well, they should have done it the second day when he was trending downward, or the day that he had a 54 O2 saturation and labor breathing. This should have been their clue. 5 days later, I think they were hoping he was going to throw a blood clot. They decide to finally CT scan him. And of course, it comes back as positive for 2 PEs in his left lung and right lungs worsening with continued infiltrates. COVID lung. So they increased his blood thinner, which if he had been on the right steroid and had been given IV fluids, I don't know that he maybe not. COVID was a clotting issue problem. It was. But the fact that they gave him Lasix, which is a diuretic, and didn't put him on IV fluids to make sure he didn't get dehydrated and then track his fluid in and outtake. I don't know. But I really believe that steroid was probably the key there. If he had the right amount of steroid, it probably would have avoided this blood clot. Thank goodness he was moving around, because if he hadn't been exercising, probably would have had blood clots in his legs.
Yeah, we had started PT at that point, and that PT was really good. She was good, but she just didn't come every day, so I had to do my own.
Yeah, that was the other thing. PT should come at least once a day. Day 14, 10/26. Lee is finally issued a pulmonary physician. Yeah, that's a story in itself. Kept asking for one. They kept saying, oh, he's not bad. And then a doctor would come, well, he's bad. Well, if he's so bad, give me a pulmonary physician. Oh, he's not that bad. There's other people that are worse. But because he got diagnosed with PEs, now by default, he had to have a pulmonary physician. Day 15, 10/27. This is what I like to say is the part of the story, is the exit from the twilight zone into good medicine. Thank goodness for Dr. Price and Dr. Dudley. These are the people that got Lee out of the hospital. So there was a PA that came in with a pulmonary physician. The pulmonary physician was not worth her weight in gold, salt at all. But the PA, unbelievable bedside manner. Excellent. Why is that? Because he actually listened to me and actually wanted to problem solve. It was so good. And he explained himself. He didn't just flippantly say yes or no.
This is COVID protocol.
Oh, this is the COVID protocol. So basically what I said to this PA when he came in the morning, I said, look, the nurses are playing this game. Can you please just put it in your notes? If he has an oxygen issue, turn it up just a notch or two. If he's on 6, let's not go to 10. Let's just turn it up a couple of liters. They can stand there for a couple of minutes, see if he breathes deeply and recovers, and then pull it back down, see if he stays recovered, and then leave the room. Can we do that? And the PA said, yeah, I'll put that in my notes. Well, I kid you not. It was an hour later that I get a message from Lee, and Lee says, they're moving me. What do you mean they're moving you? Because he still, by their standards, is infected with COVID. Back then, you were considered to be infectious for 20 days after your positive COVID test. After that, or on that 21st day, you're no longer contagious. And then they changed it to 5 days. And if you were without a temperature, you are no longer able to infect others. Very convenient, I would say. So I was like, well, they can't be moving him out of the COVID wing. And he said something about, well, they said they're going to consolidate patients. I don't know. He got some runaround.
Yeah, it wasn't clear why I was being moved.
Yes, but it became clear later on to me as time progressed. What was the new room like? What was different? Do you remember?
Oh, a huge window.
Yes.
Where I could see skylight, sun, trees.
We're talking 15 days without sunlight, without natural lighting. And it was a huge room that Lee was describing compared to this tiny box that he was in. Here's the $1 million question. Could you still shower?
I didn't shower the whole time I was in the hospital.
No, So there was a shower in this room, but again, it was full of COVID stuff or supplies for the hospital.
Yeah, I think that might have been the supplies. The other one was the chairs.
They would not move. So by 4:50 that day, Lee was moved. And do you remember, Lee, what happened when you got moved into this new room? What the nurse did with you?
Gosh, I know this is not it, but I do know that they didn't feed me for a long time. I had to ask for food. It was like they had completely forgotten that I had to eat.
Oh, gosh. I did not know that. That's the second time that happened. When they initially moved you from the hospital that was 5 minutes from us to the one that was an hour, you hadn't eaten basically in a 24-hour period. I'm going to have to drive down there and give him food. It's just unbelievable. No, what happened was, let me refresh your memory. You started off the day at 10 liters. The PA turned it down for us, this pulmonary PA, to 7 liters. Then you got moved. And the first thing the nurse did, she took off your O2 and threw it on the bed.
Oh, I didn't think that was that day.
I
mean, I remember.
Yes. She threw it on the bed.
A test.
And what'd she ask you to do?
Like stand and then walk and see if I could recover and go sit down. It was not good the first time. I'm like, I can't take this thing off. I'm going to die.
Yes. So Lee psychologically was like, what in the world? I was on 10 liters at the beginning of the day, and now you've totally taken me off O2. And so what she was doing was she was testing, to see what you were going to do without oxygen, and then to see how well you compensated when she put it back on. Do you remember what she turned it down to? So you started at 10. You were at 7 when you got moved.
I thought it was 3.
She turned it down to 3 liters. Yes, she did. And Lee said to her, I don't know, that's kind of low. I'm a little concerned about that. And she said, well, your numbers look good. I'll keep watch. I'll let you know. and it might have bounced up and down a few other times, but in general, you remained at 3. Now, let's just think about that. They were playing this crazy game of going from 6 liters all the way back up to 10 or 12 every single day. He gets moved to a room. The nurse actually takes his O2 off and then decides he's okay at 3. I'd say that there was a big difference between how he was being treated at this first room he was at and the second room that he was moved to. I don't know. Something's a little funky about that to me. It was as if the pulmonary physician that was with the PA, who was a pulmonary PA, had conferenced with each other after they left that day and said, well, fine, if he doesn't want, nurses waking him up to tell him to breathe. Let's move him to a place where they're not going to be these Nazi nurses about the O2. I don't know. But you know what? It was a God wink because this was the start of getting you out. This was the checkmate to the oxygen game. And let's terrify the patient game.
He gets into the room. The nurse comes in. She turns it down to 3. Oh, I don't know. Is that too low? I'm going to be monitoring you. I'll be watching. And she walked out of the room. Oh, man. Maybe this was a God-ordained move. So then Lee told me that he had to go to the bathroom. And so he got into the bathroom. And he said he was laboring. And he's like, okay, I have to calm down. I need to breathe. And he breathed his way through it. And he recovered. Did what he needed to do in the bathroom. He got up and he moved to the chair. And again, he was laboring a little bit. And he needed to breathe. And he's nervous. I thought I was going to need some help. And he knows he's at 3 liters. And so psychologically, he's thinking, oh my gosh, I don't have enough. So then he looks up and he sees that there are 2 pairs of eyes peering into his room. They peered for a little while. And then one of them came in. You doing okay? Yeah, but I didn't know if I was going to need help. Yeah, I know I've been watching, but you're recovered now. So you're good. And she walked out and I'm like, oh my gosh. Where have you people been? This is what I've been saying for nearly 2 weeks now. I don't care. At this point in time, I'm just thankful and I'm praying. And he's been on 3 liters ever since he moved.
And now we come to it. So what? So what, Dr. Toe? Well, the so what is this. We need heavy and lasting change in healthcare legislation. Discrimination should have heavy legal consequences. Legislation needs to protect patients' rights. Politics should never be involved. in medicine, and hospital administrators should never dictate how a healthcare professional practices medicine. The legislation needs to come about to permanently ban medical mandates. Legislation needs to be added to vaccine status protections to the patient's Bill of Rights. We must fight for what is right to protect ourselves, our health, and the things that we hold dear. Medical interventions must always be a choice. Well, that's a wrap. If you like what you heard, please share. Want to hear more? Please subscribe. And if you're a faithful listener, thank you for all your love and support, because without you, I would not be here. I'm glad you are along on this journey with me. We have each other, and we are not alone. Tune in next time for the conclusion of the hospital ovens and patient prisoners. Pursue health, live free, and breathe deep. Until next time, everyone, this is Dr. Toe, signing off. Important disclaimer. This podcast is presented solely for educational and entertainment purposes. I am not a medical doctor, and I do not diagnose, advise, or treat. This podcast is not intended for the substitute of advice from a personal physician, professional coach, psychotherapist, or other qualified professional. It is not intended to be used or relied upon for any diagnostic or treatment purposes, or to be used as a substitute for professional diagnosis, treatment, or conventional medical therapy. None of the statements made in this podcast have been evaluated by the Food and Drug Administration. Please consult your healthcare provider before making any healthcare decisions or for guidance about specific medical conditions. Listen responsibly.